Gynecomastia is the technical term for large male breasts. It has always been a problem, but up until recently there haven't been enough awareness for men to feel comfortable seeking solutions. Currently today we have a lot of good solutions for that problem, and consequently more and more men are asking for a solution to the problem. We see this condition beginning in early adolescence many times. And you can only imagine how terrible that is when you're an adolescent, you're in phys ed, you're in the locker room, and people see your breasts, they make fun of you. It's a terrible time in these young men's lives. And probably the greatest fear they have is when they're selecting basketball teams and it's going to be shirts or skins, and they just don't want to be anywhere around. Fortunately, we can do a lot for this problem. Now, beyond adolescence, we see men who've dealt with this their whole life, and now they have small children. They want to go to the beach, they want to go swimming, but dad doesn't want to go. Now it's affecting their lives. So we see different age groups where this becomes a crisis for them. But we have solutions for them. First thing we're going to do is make sure that there isn't an underlying hormonal problem. So we'll make sure they seek consultation by their family doctor or an endocrinologist to make sure there isn't a medical source for this. Most of the time there is no medical reason. It's something that developed and it doesn't go away on its own. We are seeing more and more men today that have this problem as a result of over-the-counter enhancement products. They'll take it for even a few months, they get the enlargement, they quit, their breasts don't go back, and they have this problem and they need a surgical solution for it. The surgical solutions would be anything from liposuction of the area, just removing it with a small incision through the process of liposuction, whereby we take a cannula, which is a blunt tube, we bluntly break up the breast tissue and the fat and remove it. Most of the time, however, we're going to actually have to make an incision and remove the extra tissue. Now, it won't be necessary to take out all of the palpable breast tissue. By palpable, I mean tissue that we can feel and know it's different than the surrounding fat. What we want to do is take out enough that we get a flat chest with no protuberance or projection. And so we can leave some breast tissue behind if we need to. Sometimes, in more severe cases, in addition to removing the extra breast tissue, we have to take away extra skin that results from the removal of the breast tissue. There's different ways of doing that. The simplest way is to remove skin around the areola, which is the darker skin surrounding the nipple. More extensive skin excisions might require that round incision plus one that extends from the areola to the fold and sometimes in the fold itself. It's very important to have a consultation with a surgeon who performs this on a regular basis so they can determine what procedure is best for you.